Good morning. Welcome to Good Morning Glendale. I'm Robert Heidt, President and CEO of the Glendale Chamber of Commerce. And today I have the honor and privilege, to sit down with Glenn Kasprzyk of American Medical Response, or otherwise known as AMR. Morning, Glenn. How are you?
Good morning, Robert. How are you today?
Doing well. Now, you've had a long history here with the Glendale Chamber. You're involved in many chambers and organizations in and around the area. But for those that might not know who you are, would you take just a moment and share who Glenn is?
Yeah, great. So I'm Glenn Kasprzyk. I'm the president for the Southwest region for American Medical Response here in Arizona. We service many of the communities around the Metroplex of the greater Phoenix, Maricopa area, and we service Glendale on a non-emergency basis and have been a member of the Chamber for many, many years. We have our regional communication center based right there in Glendale. Matter of fact, right behind the Chamber offices. So we're your neighbor over there. The Chamber's done great work over the years. We're proud to be a member. And I also real quickly want to congratulate you on your One Community Award as well. That's going to be coming up here in October, I believe.
No, that's awesome. Thanks, Glenn. And let me thank you because you also served as a panelist with myself, I think Mary Giles, and a few others recently on one of the One Community panels. So thank you for your support of that great organization. And of course, supporting Glendale Chamber. And you're right, you are neighbors. So we get to see your folks quite frequently since you're right next door. So it's nice. We feel safe. I feel like if we're calling, we're probably very safe because you're right there. But all things aside, you run a very critical organization. We're in a time of need and crisis. You're who comes. Your folks are who come. So before we get started, I just want to say our hearts go out to your organization for the folks that you had impacted down in Tucson recently. It certainly is something we never want to see, but our hearts did go out to you and your family, and obviously your organization, because it impacts everyone. So not to start off on a somber note, but we were there with you and thinking about you. But a couple of things.
We appreciate that. Yeah.
You all have been probably, and not probably, I think you all have been probably taxed to the max right now. What have been the challenges that EMS has faced as a result of COVID?
Wow, that is a great question to start off here this morning. It has been, this last 18 months really has been a true trying time for not only us in pre-hospital care, but all of the healthcare providers, right? As we've had this ebb and flow of COVID, last year when everything got shut down, we saw a significant downturn in emergency ambulance use as people were most likely a little scared to go to the hospital because of COVID and they might catch COVID. Unfortunately, we think that probably has some long-term effect now where people may be put off. They were having some chest pain or they didn't feel right and they didn't go to the hospital, and now they now have a condition that maybe is advanced. So that was one challenge we saw, was this massive drop off in volume. Two was protecting our healthcare providers and protecting our patients and interfacing with the hospitals. Was how did we have all the PPE, one, to have it available at that point in time for our providers, having them use it appropriately and properly all the time to protect themselves, also trying to work and protect the patients that were symptomatic or may not have been symptomatic to ensure that if they did or they didn't have COVID, they were best protected against that. And then as we transported patients, making sure that they were comfortable getting into the hospital, and then certainly getting the ambulances back into the system. Now, fortunately, like I said earlier, we saw a little bit of reprieve on that because we didn't have the 911 volume, but you still had the calls. We still had the interfacility business or the non-emergency business that was still happening. So it created some very unique challenges. We had providers all over our company go out sick, several here in Arizona, and to varying degrees. So they would be out a minimal amount of time. Some were out a lot longer. It just depends on how COVID impacted them. And Robert, it was a changing environment, right? We didn't know what was going to happen the next day. So trying to make those tactical adjustments and working with our community partners really put the system to a trying moment. But ultimately, the good communication, the partnerships, those types of things really were self-evident and helped alleviate much of that. And even with the Department of Health Services, communicating with them, we stood up a transfer center to be able to route COVID patients that were being moved. So one facility didn't get inundated with more than another facility to try and keep good load balance. So, we still are feeling those effects today with the Delta variant. People are still getting sick. We still have to maintain PPE. Hospitals are at or over capacity, so we're trying to route patients still the right way. So it continues to be a significant ongoing challenge in the pre-hospital environment.
I'm in amazement, I think, of folks like you and your folks that work at AMR to, again, you're on the front lines, whether it's a car crash or someone who might be experiencing chest pains to COVID. I mean, they dive right into what's happening. So I can't imagine the pressure and stress that was added for your folks throughout the pandemic. So I would imagine things change, and it's probably changed your industry some. I mean, you mentioned PPE. Prior to COVID, I'm sure you had an ample supply, but when the shortages happened, I don't know, does that change how you all look at supply chains going forward, or what other changes do you anticipate for your industry as a result of COVID?
Yeah, certainly the supply chain and getting PPE was a significant issue early on. And then we were also dealing with, you hate to say it, counterfeit PPE, right? And talking to other colleagues or other partners in the community, everyone was trying to get PPE, and we wanted to work through our internal process with trusted providers. We had heard stories where companies or agencies had to put up money to get the PPE and they would never get their shipment, or they got counterfeit equipment. So one, keeping our providers safe was important, but two, it did make us look to say, how do we better position for the future, right? We knew that the pandemic was going to be sustained. We knew that maybe not to the degree that we're seeing with the Delta variant, but we wanted to ramp back up to make sure if we did get in the same situation that we had ample amount of PPE. So supply chain was important. Adapting, I think what COVID also allowed us to do was transport patients that were lower acuity to alternate destination, which is something that's been around for some time, but I think COVID really put the spotlight that certain patients that met certain criteria didn't necessarily have to go to an emergency room, that a freestanding or an urgent care clinic in certain circumstances through the waivers was appropriate. Now, what I think that's going to do going forward is we're going to take those lessons learned and continue to apply that in this changing healthcare environment. People look at healthcare differently today. We hope that people continue to get good healthcare themselves, right, and not be afraid to go and seek healthcare because of the pandemic. But it's also incumbent on first responders to be able to get patients the information when they're reluctant to go, to work with our hospital partners, our base hospital medical directors, and not get patients to refuse, but to get them into healthcare. So I think that's been a remarkable change that we're seeing, because I think that also gets patient a better outcome at a less expensive price. Now, it changes the ambulance model, because an ambulance model is fee for service, but I think as an organization and our parent global medical response, it opens up new doors to offer different services, which really are the most appropriate way to start delivering healthcare. When you look at nurse navigation, where people call 911 and they go into a different track if they're lower acuity, alternate destination, and then we're working on a project here in Arizona that will actually treat patients who are still technically admitted to the hospital, but they will actually be discharged from the hospital, but not discharged, and then will recover at their house under the care of the facility that they're aligned with. So it is really driven change, and I think it's accelerated because what we learned is some of the things that we tried doing, people maybe were skeptical about, really showed that there wasn't a change in an outcome in a negative way.
Wow. And I would think that, like you had mentioned earlier, there was a lot of folks that may have ordinarily called 911 for services that didn't. So by the time they did call, it might have been more severe or probably at a worse case because people were afraid to call. So it was like they're only calling if it's gotten to a catastrophic point. So it's probably put, your staff on edge where they have to just think even quicker and be more responsive. And so changing gears to your staffing first, I love that you all are very active on social media because I see a lot of things that you promote about your staff, whether it's awards or recognition and things you do. So that I'm sure that's helping with some of the morale. But really, I would imagine this has impacted your employee staffing or your industry. How is this affecting you all from maintaining that workforce and or attracting new people into your field?
Man, if you got the answer to that, I'll buy the book from you in a heartbeat. What's happening to us, I don't think is anything less or more unique than other industries are experiencing. We have seen a shift away from people entering the healthcare environment, right? And it's just not exclusive to ambulance providers. We hear it from hospital colleagues. We hear it from home health providers. We hear it from ancillary care services as well. It is tough in today's day and age. I mean, one is the minimum wage has now compressed into our entry-level wages. So we have tried to continue to raise wages to attract people into the industry. The challenge is there's a lot of equal choice out there. And to your point earlier about stress, a lot of less stressful jobs where people can come to work, do their job, and get out on time. In our world, you may not be able to get out on time. We typically work a 12-hour shift, and you're very busy during those 12 hours. And you're exposed to a tremendous amount of experience in your job, good and bad. I mean, our goal is to help patients and improve outcomes. But we do see people at sometimes their worst moment in time, if they've been traumatically injured or they're having a significant heart problem or a stroke. And then you combine that with the loved ones around them. And then add in, unfortunately, what you mentioned earlier, the situation that we had in Tucson where our crew was so sadly ambushed. There's a lot of different forces that may not make our industry as attractive as it used to be. And public safety, I think in general, is probably fair if you were to speak to law enforcement or fire partners. The number of people that are interested is shifting. So with that, we have to be more creative. We have to use a social media platform. We have to show and attract new, what we would call non-traditional employees into the workforce. So historically, you have these long family lineages of people getting in because their grandfather, their father, their uncle, their brother has been in the industry. And we're not seeing that anymore. We're seeing a significant shift away. Now, the positive side of that is what I mentioned earlier, is the new modalities in care with nurse navigation and alternate transportation and treatment at home is helping alleviate some of that stress. But for the foreseeable future, if we don't pivot and attract things different and be competitive, we're going to continue to challenge to get people in the healthcare. And the nice thing with our industry is it's really a great stepping stone for a lot of people that come into emergency medical services, because it opens up the door for them to go on and get a job in the fire service or move into a hospital setting, becoming a nurse, a physician's assistant, or going on to medical school. So if we lose that, it's going to create a significant stress in the workforce. And we're already seeing that today. I would say too that COVID probably just put a brighter light on it, that those industry trends were changing even prior to COVID, but now COVID accelerated that change in behavior. So as people may have been thinking about a career in EMS, COVID may be, no, I'm not going to do that because I don't want to bring that home to my family and then bear the burden if I brought it home and got my family sick and somebody had a bad outcome from that.
Well, I think you said it. You're not alone. I think the entire healthcare industry is feeling the pressure of staffing and the right people for the organization that they serve. So we couldn't do it without you because again, you're kind of there in the silent. You don't know that you're there until you need you. And then when we need you,
Right.
it's almost like we need someone or someone to come to the rescue. So it is tough. And you're right. I think what's interesting is it is a gateway to the other kind of healthcare sectors of interest. I think I shared this with you before. I went through EMT basic and intermediate in my prior life in the casino
Yeah.
industry, and so I got a bird's eye view of what you all do. Went through the through the schooling and education, and it's amazing to see. It really is. I mean, you're really taught a lot of stuff, and I know there's the next level to go to probably ride in one of your rigs to actually provide service. But it's tough out there, and hopefully, as we work through COVID, some of those challenges will work themselves out, and people still will see your organization and your field as a very, very viable opportunity for themselves for a career. It's very much needed in today's world. So thank you for that. What would you say?
Yeah.
Sorry, Glenn, what were you gonna say?
No, thank you for that. I mean, I think, that this is evolving, and, this is why being a member of the chamber, I think, is even more important today, right? Is we have to look to best practices of other chamber members and maybe in a non-traditional environment on how they're attracting workforce to create a pathway in. So, if you're not thinking differently today, then you're not evolving. And, 5 or 10 years ago, we may not have seen that relationship in this sense today that we see it. It was really more, we want to be part of the community. The chamber is a great extension of that. But now the networking opportunity that the chamber and our other chamber memberships give us really is, I don't have the recipe book on how to hire and recruit people very easily. So there is a lot of benefit to seeing what people are doing and how we can bring that in and leverage that.
Well, and I think the demand is going to continue to grow. I mean, we've just become the 5th largest city in the US. So there's more people, there's more opportunity for accidents and incidents and needs of your services. So that's only going to continue to rise. But hopefully what that does is bring in an additional qualified workforce or those new folks that want to see AMR as an opportunity for their career. So again, we'll keep moving forward with that. And I know that you're very involved in chamber. As chambers, we all get along well. And I think you are currently the chair of the board at the Mesa Chamber over with Sally. Is that correct?
Yeah, that's correct. First year as the chamber chair. And again, it just emphasizes the importance and the value that chambers bring to businesses. I can't stress that enough. I know people look at membership and chambers have had to pivot during COVID. Like the Glendale Chamber, many other chambers brought new programs in. They pivoted around with Zoom meetings, bringing experts in. And I really think it just expanded the value of what a chamber can bring to a business and collaborate. Oftentimes people see it as a membership and a sticker on the door that you're a member, but I will tell you, people who take advantage of their chamber membership and utilize it, get great benefit from that. And especially like us, we're in your multiple jurisdictions. If you're not plugged into the community and active, you're missing out. So we value that membership. I value our relationship and my position with Mesa, and certainly we're going to continue those, for the foreseeable future down the road, because if not, we're going to lose out on opportunity.
Well, we appreciate that. And I'm sure Sally does as well. I know they're doing some great work over there. What would you say, Glenn, is one of the things that's probably surprised you most throughout this last year and a half, almost 2 years now that we're living through COVID? I mean, there certainly is the heartache and the negative side of things, and the death that we've encountered as a society, but there's been some bright shining experiences or things that have come to light. What's something that rings true to you that says, brighter days are going to be ahead, even though we've had some tough challenges, there's something positive in here?
I will tell you, reflecting back, and I love this question, right? Because I think it's very easy to point out all the negative and tragedy that's occurred, through this pandemic. But I think what stands out most is neighbors coming together, the human kindness of this, the compassion, the understanding, and the collaboration of people to get through a tough time that, everyone seemed isolated and alone because everything shut down. But through your networks and through your community engagement, we still stayed connected. And I saw technology evolve, people getting together and speaking more, whether it was, online through a platform like Zoom or just having a conversation, to really see and feel how other people were doing emotionally and checking in on them and asking how their family was. Those were the things that I think, when I look back over the last 12 and 18 months, that I saw more of in that period of time than I think even before. I almost feel like we lost a little touch of everything. Our lives became so fast. We kind of forgot about our family, and we, not purposefully, right? We just, move in a very succinct way every day. And COVID kind of slowed that down for a little bit, especially when everything was shut down. And I think it showed that we're all still human, and we all still have to be kind to each other and work with each other, because we depend on each other to survive. And that's something that I think was really a bright spot through the tough times, when people that had, challenges emotionally with things or family concerns, is they could reach out to you and say, any ideas or any suggestions you can give me? I want to be able to get through with this. And just spending some time virtually with people, I think, was fun. Even connecting with old friends through virtual happy hours and things like that. It really said, look, take time out and do that, because you had to get creative. And that was the best part of it. And we try and make it a point of that, with our family and friends, to make sure we're better connected.
Well, I agree with you. I think, there's certainly the impacts of COVID, but there's been a lot of bright, shiny moments that I think we have to tap into and remind ourselves that, there were good things that occurred and happened over the last year and a half, going on 2 years, it seems, and then continue to look forward with that. So I don't want to take too much more of your time, because I know you're a busy, busy man. I thank you very much for taking some time out. But anything that I didn't ask you today that you want to share with our membership and our members about AMR, or things that you're doing?
No, look, I appreciate the time today and this morning and spending it with you. Certainly we see ourselves really as an integral part of the healthcare community. So we're happy to come out and speak to organizations, talk about how we're transforming pre-hospital care, and really be there. If people have questions, even through some of our programs that we've done with Safe Restart, as we still continue to get back together as groups. Certain groups still are extremely cautious and want extra precautions in place, and we have services available. So, our organization, although predominantly is ground and air ambulances, we do a lot of other things as an organization, and certainly can reach out to me or Dave Tantone through the chamber, or directly personally in the directory, and happy to talk about what we do as an organization. So, again, Robert, thank you for your time this morning, and certainly was great catching up with you.
Thank you, Glenn. I think you're very vital. So I don't think you're just an important part. You're extremely vital. And so I won't put you on the spot, but maybe in the future when you can share some of the craziest zany stories that have occurred, that maybe that'd be in a blooper or whatever. But I don't know, if you're like me, I probably, and I don't think I've had to call 911 for services, but if you're like me, I probably Googled my symptoms or whatever it is. So by the time your folks get there, I'm trying to tell them what's wrong with me, when they're trying to probably assess my situation. So I would imagine that happens a lot of times now that we have such a wealth of knowledge at our fingertips, that your team is probably like, okay, just relax a moment and let me help figure out the situation.
It is funny, right? Because you can Google search something, and it almost seems like, you Google search a symptom and it will give you a myriad of different things, from the worst potential scenario to the least medically scenario that you could have. I would tell people this: when you're having an emergency, don't get consumed Google searching. Call 911, have the healthcare professionals come. We'll get you to the right spot. We'll get you taken care of. And, don't worry about that. I live by the simple adage in life: 99.9% of your worries never come true. But when you use Google, it seems like you have 99% of those problems. So I try and stay away from that search engine. But I could share some great stories, and maybe we could do an episode in the future on that.
I love it. And then one other quick question before people go: how many people here are total in part of your organization?
So in Arizona, totally, we have about 2,300 ground, air, and support services. So we're a large service provider, not only again in the Phoenix, Maricopa Metroplex, but around the state. And we account for about 60, just a little over 60% of all patient transports in the state of Arizona as AMR through its legacy companies, Rural Metro, Southwest, et cetera. So we've been a provider in Arizona for many, many years. We look forward to continuing those relationships for many years in many of the communities that we serve.
Well, thank you for that, because what it does is it reminds people, while you are in the healthcare world and providing those critical services, there's also great economic impact that you and your team have within the state and in the region. So thank you very much. Anything else before we close out, Glenn?
No, look, again, thank you this morning for taking time, and certainly always look forward to the relationship and the partnership we have with you and the Chamber, and certainly hope that members take advantage of everything the Chamber has to offer.
Well, thank you, Glenn. Thank you to all of your team at AMR. And for anyone out there watching, if you or anyone you know has an interest in a career, please let us know. We're happy to connect you with Glenn, or anyone on his team. So with that, we'll see you next time on Good Morning Glendale. Have a great day.
Great, thank you. Have a nice day.